I want to start treating kids. I don't want to wait until the problem is totally established. When I started treating these kids, I saw that a lot of them had sleep and breathing issues. Why I am gonna wait until the child is 7, 8, 10 years old when 70-80% of the facial growth is already happened. So I prefer to treat early. We are correcting all the craniofacial problems and the patient is receiving health. And health means better breathing, better sleep, feeling better. We are treating the structural and functional problems of the mouth, and in that way, as a consequence, we are giving the child a better airway. If the patient is with the lips apart more than 30 seconds when he's awake, that patient is a mouth breather. It's a mixed breather. Once the patient is able to breathe better, now the tongue can come up easier and the patient is able to have the tongue on the roof of the mouth. Because the tongue is the best palatal expander. And today we know that a CPAP machine should be the last resource in a child. I see a lot of children that they go for an sleep test and then the doctor say, no, your child is normal because your child doesn't have OSA. Right? But what happened? What happened with the snoring? What happened with the restless sleep? What happened with the grinding the teeth? What happened with all these symptoms that are showing that the child is having a problem? Don't wait until they are fully diagnosed as an OSA child. And if we look, the number of childs, the percentage of child with OSAs is very low. But the percentage of children telling us, my child is snoring, my child is grinding the teeth, my child is with the mouth open when sleeping, is huge. Studies are showing that just the grinding is occurring at the same time with the respiratory effort. So when the patient is reporting to grinding, I have to check for an airway problem. We are changing the genetic expression through the environment. The success of the treatment is based in a good communication with your patient. The only way to give health to the patients is to understanding the biology of the body and how we can correct the problems that are affecting that physiological stage of the patient. I really enjoy working with kids. Once the kids understand what you are trying to do to help them, they are amazing.